we're going to talk about infections. This PowerPoint goes in order of most important to least important, and I will say when I think if you want to just be okay with infections, you will just want to be able to get most things, I will make a point to say this is where you should stop. But if you want to be able to get almost everyone that they possibly could ask, watch till the end. The ones at the end also will help you get on other toss-ups and bonuses. The most hard-hitting one, I would say HIV. HIV/AIDS. HIV is a retrovirus that causes AIDS. Retroviruses are a type of RNA viruses that use something called reverse transcriptase. Reverse transcriptase then creates DNA from RNA. So it works much like a polymerase, but it inserts DNA onto the RNA. It's a single strand, right? So HIV it infects T cells. So it's in targeting the immune system, hence its name, which is human immunodeficiency virus. It attaches to CD4 plus receptors with glycoprotein GP120. And it can also hide its GP120 by glycosylation. This creates a window period where screening becomes negative because we cannot detect HIV because we generally do it by detecting GP120 through the virus. So the replication of virus is inhibited by thymine analog, AZT, by interrupting reverse transcriptase. So, we're inhibiting its ability to insert genomic material. The Trophile assay is utilized to determine what receptor, CCR5 or CXCR4, is being used. Trophile assay is specific to HIV. So CCR5, CXCR4, both very good clues to know, along with CD4 plus and GP120. The capsid, which is the protein cap of HIV, is made up of P24, which is encoded by the GAG gene. We see GAG gene come up a lot as well. The structure of the genome is called the Cy packing element, which is 4 stem loops. So that's just the structure that the RNA genomic material is structured. And I would be careful because sometimes they do not prompt on AIDS. Generally, this is college level tournaments. Or even I think sometimes Masonic doesn't prompt on AIDS if they ask for the pathogen. Or the agents, if they ask for the disease or the illness, they want AIDS. So just be careful. There will be another video which we talk about AIDS specifically in talking about what it actually can cause to the body. And that's something you'll notice the difference between HIV and the other infections we talk about. I actually talk about some of the symptoms going forward. Influenza is the next hard-hitting one. There are various strains and variations. Comes in swine and avian/bird variations. Most famously is the Spanish influenza. They sometimes bring that up at the end of the question. The vaccinations changes strains based on a pool of expected strains. A, B, or C are the denoted ones. So they generally choose 2 out of the 3 to then give the body or give to people based on epidemiological research and the genetic drift that they have been studying. There is a high dose variation of influenza vaccination that we give to seniors. That just means there's actually more virus to better stimulate the immune system because the immune system goes down, especially in those 65 and plus. Viruses have families, if you are not aware of that. So influenza is part of the Orthomyxoviridae family, which are inhibited by zanamivir and oseltamivir. So those are 2 very good drugs to know. This drug specifically inhibits an enzyme that cleaves sialic acid. So this is one of the main functions that influenza needs to reproduce. So preventing that enzyme is good for us. Composed of 8 segments of negative sense RNA. So there's a difference between negative sense and positive sense. Negative sense means it will not transcribe directly into protein. positive sense does it means. We use this generally to describe genomic material. The H274Y mutation renders it drug resistant. So this is an amino acid. This is an amino acid. Why am I blanking? Amino acid change at position 274 on the DNA or RNA rather. So this is at like the almost 780th amino nucleotide. There is some sort of mutation that makes this drug resistant by changing the conformation of the protein. The PB1 gene has the polymerase and apoptosis gene. You're wondering, why does a virus have an apoptosis gene? So it can leave the cell. So it can breach the cell and keep infecting more cells. The uncoding requires M2 ion channel, and so we need uncoding to allow for viruses need uncoding to allow for the genetic material to be inserted well. And amanine inhibits that process. Scientists actually often study this disease in ferrets, which is a breakaway from generally studying in mice, so it's very interesting to note. Influenza viruses typically target epithelial alpha-2/3 or alpha-2/6 type receptors. So this is where they bind to and then are able to inject the genetic material. Next is probably tuberculosis, TB. It's formerly known as consumption, sometimes actually shows up as a clue. It is caused by Mycobacterium tuberculosis. We test it through a PPD skin test. So actually what they do, if you've ever volunteered at a hospital or anything, they inject your forearm with a chemical. And then after 3 or so days, there should be a bump on your skin. If there is not a bump, you are tested positive for TB. Now, there are some people who are non-infectious who test positive for TB because they received the BCG vaccine, which means they have the antibodies required. So just important to note that just because some people test positive for TB does not mean they are contagious with TB. They use the Zeal-Nielsen stain to classify what type of TB there is. There are different types of TB, different strains of Mycobacterium tuberculosis. So it actually has a lipid-rich cell wall, which is contains mainly mycolic acid. So we cannot accurately gram stain the bacteria. Gram stain is generally how we tell if a bacteria, what type of bacteria we're dealing with, if we're dealing with gram positive, gram negative. But mycolic acid actually repels the stain. So there's no stain binding, so we can't actually visualize the cells. Bedaquiline is used to treat TB by inhibiting ATP synthase. ATP synthase is what actually is going to make the ATP or the energy currency for the cell in the bacteria. There's also two other drugs, isoniazid and rifampin. Generally, we will see chest pain and bloody cough as low-level clues for tuberculosis. Rasmussen's aneurysm is a type of erosion of the pulmonary in pulmonary cases, which means it's in the lungs. That's generally something mid-high level. Interesting to note that TB can also be extrapulmonary. So TB can spread out of the lungs and into other part of your body, such as the spinal fluid, which is very dangerous. And depending on where it can go to, it causes various symptoms because it's attacking a different portion of your body. Malaria. Malaria is caused by a parasite of genus Plasmodium. There's different types of malaria, but Plasmodium is the genus. It's carried by mosquitoes. Those with sickle cell anemia heterozygous or sickle cell anemia resist malaria because of their shape of the blood cell is a bit different. This is called a heterozygous advantage. So that means when someone is heterozygous for something, they have a genetic favorability. When they're homozygous, they have either dominant or recessive. It's faulty. In terms of sickle cell anemia, or they're less competitive, I should say. They're not faulty. In terms of sickle cell anemia, if you're homozygous for the dominant, which is having just normal blood cells, malaria can more easily infect you. And if you are homozygous for the recessive, which means you suffer from sickle cell anemia, your blood cells are shaped funnily and it has difficult transporting the oxygen it needs. So heterozygous is the kind of that comfortable balance that you want. Quotidian fever occurs in malaria, which means you have a cold stage and a hot stage and a sweating stage. This is the preliminary symptom we see. Henry Heimlich, in a complete sense of idiocy, he made the Heimlich maneuver, but said malaria could be used to treat HIV. He was wrong. Don't do that. But this is an okay clue for HIV or malaria. Its main vector is Anopheles mosquitoes. Anopheles is a genus of mosquitoes, so there's different species of it. Anopheles is actually commonly used to spread a lot of different pathogens. Zika virus is another one of them that gets spread through the Anopheles mosquito. Hypnozoite, which is the dormant parasite, kind of like an endospore for bacteria that is present in bacteria, can exist in the liver when you suffer from malaria. So one of the scary things about it is that it can come back, or there might be a window period where you're not suffering and then you come back and all of a sudden you're studying for malaria. It can exist in the vivax species of Plasmodium, so Plasmodium vivax. This is one of the reasons why if you travel to malaria-infested countries, you cannot donate blood for a long time. I think it's like 5 years after that trip. So something to keep in mind. Hemozoan forms in this disease, which is also crystallized heme groups. So these causes various issues with your blood flow. You can actually treat malaria with aromacin, chloroquine phosphate, atovaquone, or methylquine. Quite famously, explorers would drink gin and tonic. The tonic was to treat for malaria, and the gin was to help it go down because the medicine was horrific. I want to say it was chloroquine, which was the chloroquine phosphate, which was the tonic, but I cannot recall specifically. But they never asked that. They would just say gin and tonic. Syphilis is one of the lowest end that you should know. It's a sexually transmitted disease that they tested on black men in Tuskegee experiments, specifically black sharecroppers. This was a horrific violation of human rights during, I want to say it was Reconstruction. It's caused by Treponema pallidum, which is a Spirochete type of bacterium, which means it's kind of like a spiral. It can be detected through microscopy, supported by TPHA or FTA-ABS. I think those are staining methods. I'm not 100% sure on that. You can also test for syphilis through VDRL and RPR. These are just buzzwords for microscopy or for syphilis. Salvarsan was used to be used to treat syphilis. It was an arsenic-containing medication. It was known as the magic bullet cure, developed by Paul Ehrlich. Salvarsan will show up a lot for syphilis questions, so I would know that for sure. So for those of you who don't know much about syphilis, it's a long-lasting disease. I believe it usually manifests for about 7 years. It also causes people to go insane as it gets to your brain. It begins as chancre on the genitalia, which is kind of like a bump. It causes bilateral rashes, which is also known as palmar erythema. Also causes tumors called gummas. These are not cancerous tumors, but tumors are just amalgamation of cell growth. It forms globular enamel growth known as mulberry molars. Later stages can cause Argyll-Robertson pupils. Hygomenicus's sign is a symptom of this, and again, the symptoms depend on the stage of the disease. How far are you in? Did you ever receive treatment? Have you been taking antibiotics? Um, this is also sometimes referred to as the gift of the New World, because this is the disease that when the colonizers raped and pillaged Indians this is what they got in return, was syphilis. Okay, so this is kind of the end of what you absolutely need to know. This portion for bubonic plague, cholera, and measles, and the rest of these, I would say people who are going to be focused on science should know these. But if you are secondary science or whatever, past this point is going to be less important to you, I would say. But let us continue. These are probably low scoring ones, but they still show up once in a while, so it's worth knowing. The bubonic plague, obviously also known as the Black Death, is transmitted by a rat flea and famously killed a third of Europe in the Middle Ages. It's caused by Yersinia pestis. Funnily enough, they had an idea of immunity in the Middle Ages. They would get people who survived bubonic plague to actually dispose of the body so they weren't getting infected. They didn't know exactly how infections worked back then, but they had a general idea and they used that knowledge to have people who survived the bubonic plague to then transport the bodies. The best known form, which is a Black Death variation, is known for the swollen lymph bones on your armpits or groin. These are the big black swollen parts of your body that generally people refer to when they talk about the bubonic plague. There's also two other forms known as septicemic and pneumonic. Septicemic, I believe, is through the blood. Pneumonic is infecting the lungs, if I recall correctly. It delivers the effector called YAPS, which is a toxin, through a type 3 secretion system. Those are just buzzwords for bubonic plague. It's endemic to prairie dogs in the western US. So I guess this is a good point to talk about the difference between pandemic, epidemic, and endemic. Pandemic, like the current COVID-19 pandemic, is a worldwide infection causing issues with the entire population. The Spanish flu is another example of this. Epidemic means it is targeting a region, not just a specific population, but an entire region. So this was seen with the Ebola outbreaks. The Zika virus was another epidemic. Endemic more refers to a specific population, and it's hurting a specific population. I cannot remember. There's one that specifically is endemic to Ashkenazi Jews. I want to say it's some type of eye infection, but I can't recall off the top of my head what it is. But that's the difference between endemic, epidemic, and pandemic. So Yersinia pestis, the bacteria, secretes antigens known as F1 and V, which was discovered by Kitasato Shibasaburo. I butchered that name, but that is a clue that shows up hardly, but that's like usually the first line. So cholera is another one. It's supposedly a Bengali originated disease that spreads from contaminated drinking water. It's caused by the Vibrio genus of bacterium. So again, there's different species of cholera depending on the conditions of the water, the temperature. All these things matter to bacteria and how they live. Is it basic or acidic water? So the primary symptom is watery severe diarrhea, and the main treatment, there is medications for it, and you can take antibiotics for it, but the primary treatment is the oral rehydration therapy. The issue comes in when the water you are drinking is repeatedly infected, contaminated with fecal matter. You are just giving yourself more cholera and more severe diarrhea, and allowing for the infection to spread to other places and cause issues elsewhere. So this is why it's seen as a severe issue in less developed nations. Those with cystic fibrosis actually have a resistance to cholera and typhoid fever based on a receptor. Um, John Snow actually conducted the first epidemiological study of this disease in Soho, London. So people in London were getting infected from cholera. He was like, okay, where is this coming from? So we can try and prevent this. So he traced it back to people drinking water in a certain well that was contaminated. And that was the first epidemiological study that was ever performed. And he is known as the father of epidemiology for that. It's caused by a gram-negative strain and produces a cholera toxin and enterotoxins. And it attacks the mucosal epithelium of the small intestine, which makes sense. It's attacking your GI tract, so it causes severe diarrhea, trying to clear out your GI tract. There is an L-Tor strain, which is much milder but capable of host-to-host transmission. Cholera is famously not capable of this, but the L-Tor strain, which is a mild version, is capable of host-to-host transmission. Cholera toxin transfers NAD or NAD plus, which is an electron transport carrier, to GS alpha. This is generally shows up in some college level tournaments for NAD or NAD plus, or maybe even cholera. So that's not one I would too much focus on. Everything else I would say is pretty good to know, actually. Measles, it forms a distinctive red rash. Often we see it infect children. It is a very contagious disease. There is a vaccination for it, MMR vaccine, which prevents against measles, mumps, and rubella. Be careful, because measles is also known as rubeola, which is different than rubella. Be careful about that. Around 147 people contracted this disease at Disneyland, California in 2015 because of anti-vaxxers. So thank you, anti-vaxxers. Speaking of anti-vaxxers, this is the first disease mentioned alphabetically in the known redacted Andrew Wakefield article. The Andrew Wakefield article is the one that says vaccinations cause autism. Measles was one of the MMR. Measles vaccination was one of the first ones that was used as evidence. Obviously, this is completely false. Vaccinations do not cause autism. And this is why that article has since been redacted, and Andrew Wakefield is a disgraced doctor. Measles causes the 3 C's, which is cough, coryza, and conjunctivitis. There is the possibility of blue-white Koplik spots and can be used to diagnose this disease very early on. So you'll get like some pale blue spots in your eyes that your doctor can see, and that is a sign of measles. This disease binds to CD46, CD150, and Nectin-4 receptors. A rare form of it is known to cause brain inflammation, which is why there is an MMR vaccine for it. You do not want to get this. You don't want to have any variations because it will kill you. That is known as subacute sclerosing panencephalitis. Pneumonia. So pneumonia can be caused by either bacteria or viruses. Pneumonia itself refers to the inflammation of the alveoli, which are the small sacs in your lungs, which actually is where capillaries go to then exchange carbon dioxide and oxygen, which helps you breathe. And this inflammation causes breathing trouble because you have a hard time exchanging the oxygen and the carbon dioxide and other gases. This is why doctors will often prescribe prednisone. Prednisone is a steroid that helps with inflammation, so that helps you breathe. It is classified as both hospital-acquired or community-acquired because of how infectious it can be. And if it's hospital-acquired, you can be very much screwed because generally we see a lot of cases of hospital-acquired being superbugs or antibacterial resistant. So it's going to be, you're in for a tough ride if you have hospital-acquired pneumonia. PCP is a variation of this disorder is spread by fungi and kills many HIV patients because their immune system is down. Generally, your body can fight this off, but because of your immune system is down, it can be very difficult to actually do so. Legionnaire's disease is also a form of pneumonia that is quite common. There is a 2-step vaccination process for elderly folk. I believe it's for above 55, if I recall correctly. Prevnar 13 is the first of the shots. And this is for bacterial pneumonia. And the second is Pneumovax 23. So these are separated by a year. So first you get the Prevnar 13 shot, and then a year later you'll get your Pneumovax 23 shot. So there's a red currant jelly, phlegm. So if you look up red currant jelly, it's kind of this disgusting looking jelly that British people eat because they have no cuisine. That's kind of like what your sputum looks like sometimes when you have the Klebsiella version of pneumonia. Streptococcus is the other genus of bacteria that can cause pneumonia. Streptococcus pneumoniae is one of the ones that can be classified as a superbug quite often. Specifically SARS and MERS, they weren't pneumonia diseases, if I correctly. I can't remember if they were Staphylo or Strepto, but those are also other superbugs, which is why they were a big deal. Streptococcus pneumonia can cause meningitis, actually, which is inflammation of the blood-brain barrier. If it gets into your bloodstream, it gets to that position. So that's why pneumonia is dangerous. Pneumonia we often see as a follow-up sickness. So if you have the flu, after that like month-long ordeal with the flu, during the peak of it, your doctor will probably give you antibiotics. And why? Is because when your immune system is down, bacteria are going to try and creep into your lungs, and other viruses are going to try and creep into your lung and cause pneumonia. We see this with COVID-19 as well. We see a lot of patients who have COVID-19, and then after they recover from COVID-19, they have pneumonia. And your immune system is down, which is why this is so deadly. And it can very quickly take control of your lungs, and you will need to be put on a ventilator. So very scary disease. Speaking of meningitis, it is an infectious disease that causes inflammation of the meninges. There are 3 membranes actually that line the skull, the vertebral canal, and enclose the brain and spinal cord. Classically, it causes neck stiffness because of the inflammation within the spinal cord. So your neck feels very stiff. That's why during meningitis outbreaks, they will often tell people to try and turn their head. And if they can't, that is a clear sign that they might have it. It causes reduced glucose levels in the cerebrospinal fluid. It can occur if bacteria can pass into the blood-brain barrier, such as Streptococcus pneumoniae. It can infect a fetus if the mother eats unpasteurized cheese. Listeria can also occur, so be careful. This is one of the reasons that unpasteurized cheese is not sold in America, is because they are worried about babies getting meningitis. Actually, one of the most common infectious agents is Streptococcus pneumoniae. And meningitis can cause the loss of hearing through ossification, which is like bone stiffening. So if it stiffens the bones in your ear, which facilitate hearing, you can lose your hearing. Anthrax. Anthrax is a very, very deadly disease. This is nothing to be playing around with. It was spread in bioterrorist attacks in 2001. I think there was a scare with President Barack Obama that he had received, that the White House had received anthrax. It can produce endospores, which are long-lasting dormant cell capsules. They were first discovered by Robert Koch. It was first discovered by Robert Koch, and the germ theory's disease was found using anthrax when Louis Pasteur cultivated the causative agent, the member of Bacillus. Why they were using anthrax, I will never understand. The AIM strain is what causes anthrax, and there's a pulmonary, GI, and contagious types. So it's Bacillus AIMS, I believe. Jean-Joseph Toussaint made a vaccine against anthrax with potassium dichromate in it. It's not commonly given because it's not a very common disease to encounter. And it has a polypeptide rather than a polysaccharide for its capsule. Okay, I believe there's a couple more. So the next one up is dengue, also known as breakbone fever. This is a tropical disease that causes a hemorrhagic fever. It is mainly transmitted by Aedes aegypti, which is the same as the yellow fever mosquito. You also recall that I believe this is the same as malaria. Nope, that's Anopheles. Don't make that mistake. I make that mistake quite often. It was formerly confined to Southeast Asia. It has since spread. Dengue shock syndrome is one of the classical clues for it, and it causes dangerously low blood pressure. It's an RNA virus that has 5 serotypes, which means there's 5 variations of dengue fever. It utilizes C-type lectins to enter Langerhans cells. Generally, we see symptoms occur 14 days after infection: fever, headache, muscle and joint, and a skin rash. Muscle and joint, by what I mean by that is muscle and joint pain. Hemorrhagic fever and shock syndrome are rare symptoms in severe dengue, but that is what we commonly hear as clues. A vaccine exists, but is only recommended to at-risk populations, so that those that live in the area, those that commonly work in that area, and those who have been infected before to prevent reinfection. It might seem weird, but it is an immune system booster to give you more antibodies to it. Diphtheria or diphtheria, it denotes the D in the DPT vaccine, which is diphtheria, pertussis, and tetanus vaccinations. It is known for causing gray-black coating in the throat, and which also causes difficulty swallowing. It's caused by Corynebacterium. Emil Behring and Emily Rowe developed a serum therapy for it, and Bella Schlick developed the first test for susceptibility to diphtheria. Bacteria releases a toxin that inhibits translation, and Archaeobacteria ribosomes are especially sensitive to this. So, you know, it's a good clue for Archaea, actually. So, if we made it this far, it's a good clue for Archaea. And this with that, it indicates that their relationship with plants, animal, and fungi is pretty well. The Archaea kingdom, at least. Whooping cough. This shows up like once every 500 questions, maybe. It's a characteristic type of cough common in children. It can last for 10 or more weeks. It's also known as the 100-day cough. It's part of the DPT vaccine, the P. It's also known as pertussis. It's caused by Bordetella pertussis, a bacteria. You quite often have to receive boosters. So when you get a vaccination, doctor will also recommend you get your whooping cough booster. And in fact, anti-vaxxers have caused a resurgency in cases among more developed countries. I think quite famously, Orange County in California had quite a few cases. Yep, and I believe there's 3 more. We have Hep B, Ebola, and Zika left to cover. Hepatitis B is an infection that affects 1/3 of the world population. Chronic hepatitis B can lead to cirrhosis and liver cancer. So hepatitis B is actually a common clue for liver. There is a vaccination for it. Um, and this virus is quite unusual in that it is double-stranded. It gains entry into a cell by binding to NTCP. It's not HIV, but it also has a window period where the screening will be negative for hepatitis B, and infected cells may take on a ground glass appearance. Forgive that typo, that says B. But Hep B doesn't often show up. It might just show up as hepatitis. They might prompt you on hepatitis. If they prompt you on hepatitis, just say Hep B. That's the best guess you can get for it. Ebola, it's famous for a 2014 African epidemic. It's a filovirus, and it's named after a river in Zaire where the second outbreak occurred. The 4 causative agents are related to the Reston virus. The GP gene encodes 4 proteins to distinguish it from the Marburg disease. So it was sometimes thought to be Marburg, but there are 4 proteins that differentiate it. ZMapp is a treatment for, which is monoclonal antibodies, which is the current treatment where remdesivir is trying for COVID-19. So it binds to the glycoprotein on the pathogen, and it's cultivated, not cultivated, in tobacco plants. So what this means is monoclonal antibodies are giving people antibodies to better fight the infection. And they use 99 genomes were used to determine that the substitution rate of the genome has actually recently doubled. So that's quite scary because that means that it's constantly changing. This is the last one, Zika virus. Mosquitoes act as the vector for this virus. It's named for a forest in Uganda. Quite famously, they almost canceled the Olympics in Brazil for it. I can't remember what year that was. Maybe it was 2016. It can spread from a mother to her fetus, causing birth defects, specifically microcephaly. It can also cause Guillain-Barré syndrome. Aedes Hedseli was the vector for a 2007 outbreak in the Yap Islands. AXL is a potential receptor for the Zika virus. Acinine 154, which is a glycosylation site, that's in the envelope for the glycoprotein. And the Sherlock diagnostic kit uses CRISPR-Cas9 to detect the Zika virus. So this is actually a good clue for CRISPR-Cas9 is when you hear Sherlock to detect the Zika virus. That's all for this. Again, Zika virus, Ebola, Hep B, even whooping cough, diphtheria, I would say are very low hitting. Dengue, past dengue, all the way up to bubonic plague, I would say are medium to low. But before this, I would say these are the hard hitting ones. These 4: syphilis, malaria, tuberculosis, influenza, and HIV. So those 5 actually. But that is all for infections. There is more diseases you have to know, obviously, such as genetic diseases and things like that. There are more pathogens you have to know, more toxins you have to know. But this is a good baseline for it. So thank you. Again, you can ask me any questions you have by sending an email to me for the email in description. And please give me some feedback as well. Thank you.